Hi, welcome to my channel. If you're thinking about spaying or neutering your dog or cat, you've probably heard a lot of opinions. Some people say do it as early as possible. Others say wait. And then there are the scary stories about anesthesia, behavior changes, and long-term health risks. And here's the part most people don't realize. There isn't one single right answer for every pet. So how do you actually make the right decision for your dog or cat? Hi, I'm Ann, a veterinary technician, and I want to walk you through this the same way I do with pet owners in the exam room, calmly, honestly, and without pressure. In this video, we're going to talk about what spay and neuter surgery actually involves, the real health benefits, the potential risks, the timing debate, especially for large breeds, and some of the most common behavior myths, because this isn't just a routine procedure. It's a medical decision that affects your pet's hormones, growth, behavior, and long-term health. And one small misunderstanding about timing can make a bigger difference than most people think. By the end of this video, you'll feel informed, not overwhelmed, and confident about the next step for your pet. Let's get started. Before we talk about benefits, risks, or timing, let's start with what actually happens on surgery day, because most fear comes from the unknown. When you drop your pet off, the first thing that happens isn't surgery, it's preparation. Your veterinarian performs a full physical exam. Often we run blood work to check liver function, kidney function, blood sugar, and red blood cells. Then a veterinary technician places an IV catheter. This allows us to give fluids, support blood pressure, and respond quickly in a rare event of an emergency. Before surgery even begins, your pet receives pain medicine. We don't wait for pain to happen, we prevent it. When anesthesia starts, your pet falls asleep gently and safely. A breathing tube is placed to protect their airway for delivery of oxygen. And during the entire process, someone like me is monitoring heart rate, oxygen levels, blood pressure, temperature, and anesthetic depth constantly. For females, a spay involves removing the ovaries and uterus through a small abdominal incision. For males, a neuter involves removing the testicles through a small incision, often with no visible stitches. Recovery is monitored closely, and most pets go home the same day, sleepy, a little quieter, but comfortable. Spay and neuter surgery is one of the most common procedures in veterinary medicine. It is not rushed, it is carefully monitored. So now that you understand the process, let's talk about why we recommend it so consistently. This isn't just about preventing pregnancy, it's about preventing disease. Your female pet's spaying prevents a life-threatening condition called pyometra. That's an infection of the uterus that can escalate quickly and become fatal without emergency surgery. Spaying also significantly reduces the risk of mammary tumors, especially if done before the first or second heat cycle. For male pets, neutering prevents testicular cancer, it reduces certain prostate diseases, and it decreases roaming behavior, which lowers the risk of trauma. These are measurable, documented benefits. But here's something important. A good medical decision isn't made by only looking at the benefits. It's made by understanding the full picture, because hormones don't just influence reproduction. They influence growth, metabolism, and development. And that's where we need to talk about risks. Every surgery under anesthesia carries some level of risk. Serious complications are rare in healthy pets, but they're never zero. There can be minor incision swelling, bruising, and temporary discomfort. Longer-term removing hormones can influence growth and metabolism. Some research suggests that early removal of hormones in certain large breeds may increase the risk of orthopedic issues. That doesn't mean surgery is unsafe. It means timing may matter. Because when we talk about risks, what we're really talking about is hormones. And hormones influence growth. So the real question becomes, when is the right time for your specific pet? For years, 6 months was the standard, and for many pets, especially small breeds, that's still appropriate. But for some large and giant breeds, waiting until closer to skeletal maturity may reduce certain orthopedic risks. Growth plates close under hormonal influence. Removing hormones very early may affect that timing. So, for breeds like Golden Retrievers, Labradors, German Shepherds, Great Danes, this conversation may be more individualized. Timing isn't one size fits all. But hormones don't only influence bones, they influence behavior too. And this is where expectations can get unrealistic. Neutering can reduce hormone driven behaviors like roaming and marking, but it will not fix separation anxiety, fear based aggression, or lack of training. Spaying does not change your pet's personality, it does not take away their spark. Another common myth is I want her to have one litter first. There is no medical benefit to having one litter before spaying, and each heat cycle increases exposure to hormones that can raise certain cancer risks later in life. Spay and neuter may influence some behaviors, but they don't replace training, and they don't change who your pet is. So when you step back and look at everything, this isn't about pressure, it's not about fear, it's about informed decision making. Understanding the surgery, knowing the benefits, recognizing the risks, considering timing, separating myths from medicine. For many pets, spaying or neutering offers significant protection against serious disease. For some pets, timing deserves a thoughtful conversation. If you're unsure, talk with your veterinarian about your pet's breed, lifestyle, and risk factors. And if this video helped you feel more confident, let me know in the comments. Are you still deciding on timing, or has your pet already been spayed or neutered? If this was helpful, subscribe for more practical, honest pet health guidance. Thanks for being here. I'll see you on the next one.